Vestibular migraine. A vestibular migraine is a common neurological condition, a nervous system problem that causes repeated dizziness or vertigo in people who have a history of migraine symptoms. Unlike traditional migraines, you may not always have a headache. The manifestation of a hereditary abnormal sensitivity of neurovascular reaction to sudden changes in external pain, dietary, internal, environmental, or cyclical changes in the CNS. Do I have vestibular migraine? Definite vestibular migraine. At least 5 episodes with vestibular symptoms of moderate or severe intensity lasting 5 minutes to 72 hours. Vestibular symptoms: spontaneous vertigo, positional vertigo, visual-induced vertigo, head motion-induced vertigo with or without nausea. Symptom intensity is defined as moderate if they interfere with ADL, severe if they inhibit ADL. Current or previous history of migraine with or without aura according to the International Classification of Headache Disorders. 1 or more features with at least 50% of the vestibular episodes. Headache with at least 2 of the following characteristics: one-sided location, pulsating quality, moderate or severe pain intensity, aggravation by routine physical activity, photophobia, phonophobia, visual aura. Not better accounted for by any other vestibular or ICHD diagnosis. Probable vestibular migraine. At least 5 episodes with vestibular symptoms of moderate or severe intensity lasting 5 minutes to 72 hours. Vestibular symptoms: spontaneous vertigo, positional vertigo, visual-induced vertigo, head motion-induced vertigo with or without nausea. Symptom intensity is defined as moderate if they interfere with ADL, severe if they inhibit ADL. What causes vestibular migraine? Vestibular migraine isn't fully understood and exact causes are unknown, but seems to result from overlapping pathways that modulate pain and vestibular inputs into the brain. There are many theories have proposed thoughts to be the cause of vestibular migraine. One theory have proposed an asymmetry in neuropeptide release at the afferent vestibular terminals. Another one have suggested that serotonin may play a role in the vestibular abnormalities seen with migraine, either through direct effects or through release of neuropeptides. Such activation could be asymmetric, thereby producing asymmetric activation of central vestibular pathways. It is also thought to be caused by a combination of vascular events along with an alternation of neural activity associated with the migraine event. It is believed that these changes more commonly affect the utricle and/or the superior portion of the vestibular nerve and anterior vestibular artery, rather than the saccule and the inferior portion of the vestibular nerve and posterior vestibular artery. How to prevent attacks. Many of the triggers for migraine headache can cause a vestibular migraine. In addition, people vulnerable to vestibular migraines can experience episodes after migraine triggers, including stress and anxiety, poor sleep both too little and too much, hunger and dehydration, missing meals and not taking enough water. Dietary triggers many common foods, especially caffeine and hormonal changes. Menstruation, menopause, and in teenagers, other external triggers can include certain forms of lighting and ventilation, weather changes, smoking, and strong odors. Who is affected? Vestibular migraine may start at any age and has a female preponderance of about 3 to 1. Familial occurrence is common, pointing to a genetic origin of the disorder. It affects about 10% of all migraineurs. May occur more often in the morning, particularly around menses. There is a strong association with Menard's disease and strong family history of migraines. What are the symptoms? Symptoms are vary in duration, minutes to days, severity, character, and it may not be clear temporal relationship to headache. Common symptoms of vestibular migraine may include hearing loss, phonophobia, photophobia, abnormal speech perception, distortion, tinnitus, oral fullness, dizziness that lasts more than a few minutes, nausea and vomiting, balance loss and ataxia, cervicalgia, neck pain with associated muscle spasms in the upper cervical spine with Cutrer, extreme motion sensitivity, feeling sick or dizzy when you move your head, eyes, or body. Continuous vestibular stimulation may trigger migraine. spatial disorientation or confused with altered cognition, feeling unsteady like you're in a rocking boat, anxiety and panic. How is it treated? Treatment for vestibular migraine is similar to that for other migraines. Initial treatment is education with the systematic identification of trigger factors with a symptom diary. People with vestibular migraine can reduce the number, severity, and intensity of vestibular migraine attacks by maintaining and getting adequate regular sleep and meal schedule. Avoiding of triggers, managing stress, and making other lifestyle changes such as exercising regularly. In addition, vestibular migraine may include medicine to stop or prevent an episode. These are just some of the medications that your doctor may recommend. Beta blockers, calcium channel blockers, tricyclic antidepressants, serotonin or serotonin neuropeptide reuptake inhibitors, SSRIs or SNRIs, topiramate.